Okay, so I have a very loose understanding of Peyronie's, but can you tell us more about that and what your preferred treatment options are?
Absolutely. I mean, as a urologist, I've been taking care of Peyronie's for 30-something years. We see a lot of that at Duke. It's a major referral center. But we're now getting a lot of Peyronie's patients. In the old days, I would use something like steroids and I'd inject a man's penis. And let me back up. What is Peyronie's? Peyronie's is a curvature of the penis. And it will happen when the penis undergoes an injury that a man may or may not even remember. And the penis will then heal with a scar. And if you think about a scar does not distend. So when I'm giving talks, I'll oftentimes have a deflated balloon, and I'll take some super glue out, and I'll just put a little drop or two of super glue on the deflated balloon. And I'll talk for a few minutes and let it dry. And then I go to blow up this little wiener balloon, and it blows up except for where the glue was. And the glue's not going to distend.
Right.
And so the balloon bends around where the glue is, or the scar. And that's the plaque that makes Peyronie's disease. So the penis is bending around a scar.
Okay.
So we would inject steroids in that scar, and I would tell the guy, I go, look, if all I do is help keep this from getting any worse, we're going to call that a success. If I make it better, we're going to be dancing. Well, today we can inject platelet-rich plasma with the patient's own growth factors, and if he wants us, we can then enhance that with our human cells and tissue products with regenerative properties and inject that into the Peyronie's plaque. And we have seen guys, after one treatment, get significant improvement. We've seen guys get complete resolution. Oftentimes it does take, though, more than one treatment. Everybody's different. But that's been very rewarding, going from if I can just not make it, if I can keep it from getting worse, to I think we might be actually able to help you. And these have been studied. This has been done, there's studies now out in Journal of Urology and British Journal of Urology where others have done the same thing, and this is a very valid scientific method of taking care of Peyronie's disease. Right. Why are they come to us and not their urologist? Insurance. Insurance won't pay for it.
Okay.
That's why.
Do they consider it a cosmetic thing or talent?
Or experimental.
Okay.
At the end of the day, insurance not paying for it.
So what happens if you do nothing? If someone has Peyronie's and they sit with it?
What I tell all men is, well, it's not ever going to get better. It can only possibly get worse. It might not get worse, but it will never get better on its own. It usually does get worse.
Yeah.
So, the idea of getting started treating is key.
I'm curious, too, about, erectile dysfunction.
Okay.
Another thing I think that, men might wait on. Is that something that could resolve on its own, or is it just going to stay the same or get worse?
The very few men with erectile dysfunction, unless it's a psychological reason, get better over time. Blood vessels are getting worse. Blood flow is going down. The nerves to the penis are being deprived of blood, so some of them are dying. Just when it comes to erectile dysfunction, waiting to have treatment is not going to be an option. Again, for erectile dysfunction, the core, the foundation, once again, is testosterone optimization. I mean, I can't stress that enough. Nitric oxide, that's going to help a lot. Platelet-rich plasma injection, where we introduce these growth factors into the penis to get more blood flow and more nerve growth, is a huge method of doing things. We talked about using Botox in the penis to increase blood flow and relax muscles so that the guys that have retraction are improved. It's also the only medical way to help men that have premature ejaculation improve. That's a big one. Placing these regenerative cells into the penis, big one when it comes to helping with erectile dysfunction. We have an acoustic wave therapy device. Some people might call it Gaines wave. There's other waves. This kind of energy will improve blood flow and new nerve growth in the penis. We can use Trimix, which is a vasodilator that is a very powerful inducer of erection. So we have multiple ways to help men with their erectile dysfunction.
Perfect. So if you were to give a message to the men that might be a little bit shy or nervous to reach out, to potentially even be speaking to a female on the phone or are hesitant, what would you say is like a kick in the pants?
Dude, they've already heard it. I mean, this is what we do here. Our goal, our underlying mission is to help people live better, look better, and love better. And so they've heard it all. I mean, and you're the one that's embarrassed. They're not embarrassed. So come on, It happens. They know it happens to all of us as we get older, and you're not going to be made fun of. This is what we do.
Yeah, it's so true. Sometimes we'll talk to somebody on the phone and I might say, they might be nervous, and I'll tell them that you're the sixth person I've talked to about this subject. So you're okay, you're safe, and I won't even be able to tie the name to the story. Let's take care of you. Great.